can help change.
All right. Thank you,
And
David. Does he
last
have any
thing I
more?
want to say
Okay.
is just
Yes.
thank you again
Mhm.
for being here. I look forward to seeing you again next month and the months following. Please join us. Please spread the word as well. Share it out from Facebook. Uh, any of your friends that you're connecting with. We'll be mentioning it in our classes, obviously, and the newsletter. If you're not signed up for the newsletter yet, get signed up. All of these things. Connect with us. We want to connect. And thank you again so much for all that you do.
All right. Thank you, David and Jenny. We really appreciate both of you and all the work that you've done to help the consumers as well as the providers. And all right, so everybody, thank you for coming. I'm Roberta Lilly, training manager, and I'm looking at the list of all of your names, and I'm recognizing some of you from being in class and just over the years being devoted providers. So welcome those who have been into our training program, into our classes throughout the years, and welcome to those who are just now beginning and are curious about what is this all about. So today we're just going to talk about what's going on at the Oregon Home Care Commission training program. So we'll do kind of an overview of everything and hopefully solve some mysteries. If you feel like we've had a few mysteries going on, hopefully today will be a day for us to clarify for you. Okay, so let's go ahead and just talk about, let's start off by why bother to take an Oregon Home Care Commission training class? Well, we do offer classes we're offering classes every workday, Monday through Friday, and we offer them in the morning, afternoon. There are times when we're offering 5, 6 classes per day. So we offer them in a lot of different languages. We are offering English, Spanish, Russian, Chinese, Vietnamese, and Somali. Hope I didn't leave out a language. Hopefully, when you're in the class, you're learning some new skills, some new, maybe some new policies that have come to light, or some new practices. So learning, of course, is the most important thing about coming to class. Connecting with subject matter experts. We're recruiting, currently still recruiting instructors, but we do have a really great quality instructors. And we brought on 3 new instructors in 2024. And they are really experts in behaviors, such as masters in social workers, and a lot of work in assisting those with complex behaviors. So that was an area that we felt like we needed to expand on with our instructors. So we've recruited there and we'll continue to recruit into 2025. One thing that we've had a lot of our providers share with us, and we've witnessed in classroom, is just that collaboration with other providers. So that's a great advantage. We know that when you're working, sometimes it's a real isolated working environment for providers. So getting that opportunity to connect with others happens in the classroom. And I love it when I hear one type of specialty sharing with another type of specialty, a home care worker sharing with the PSW, a PCA sharing with the home care worker, and learning about their different jobs and the different people that they're serving, and giving other providers ideas about, gosh, that sounds great. Maybe I'd be interested in getting a provider number in that area. And over time, I'm seeing a lot of providers that have expanded in their community and have more than one provider number. And I do believe a lot of it starts from conversations happening in the classroom. We are offering classes. We used to be completely in person. A lot of you know that already, because I know a lot of you have been with us for a lot of years. And you remember, prior to the pandemic, prior to March 2020, all of our classes were in person, and our instructors would get in their car and drive across the state of Oregon into your counties, and we would offer 1 or 2 or 3 days per month in the counties. And we know that a lot of you were working on those days, and we had a lot of feedback from providers saying, we really want to be able to have the schedule classes more often, and we want to have them electronically available. And so with a lot of effort and with the pandemic came that opportunity to move into an electronic training program. Like everyone else in the nation, we were forced to move during the pandemic into an online platform. And there's where we stayed. So the majority of our program moved in and stayed in online. Now we still offer in person. We offer in person. We go in person once a month into different counties around the state. Let's see, we've recently been to Winston area down by Roseburg. We were in LeGrand most recently, and we're going to Medford in April. We're going, I think in May, I think we're going to Newburgh, and then Lincoln City area. So we're going all over the state and looking at where do we need to go, where haven't we been, and spreading that out so that we try to hit all areas. And we're advertising and making sure that we can get to all of the surrounding counties as well. So you may be getting emails from us when we come to your community, and we hope to see you in class. We always have extra room in person. We always have extra room in person. So that is a great place for folks who want to connect in person and meet. We're usually always there. Every once in a while we can't make it, but usually we have Oregon Home Care Commission staff at those in-person conferences. Zoom webinars set up similar to this one. We do the training classes throughout the week. And then online learning, you'll see some of the materials written calling it on demand. When we decided we need to make that word a little easier to understand, so we're changing it to online learning. And online learning means you don't have an instructor. You lead it yourself. You read and you take it on your own pace. So we have a lot of our material online learning, and we're creating and developing more and more classes. We find that a great way for students to come to class and work it with your very, very challenging schedules that you're trying to manage, between working with people and managing your own family and other jobs that you might have. Online learning works well for a lot of folks. We do have also want to let you know that the if you earn an Oregon Home Care Commission certification, it will fulfill the training requirement for provider credentialing. I'll talk a little bit about that later. So that means that we will substitute in on your provider number recredentialing March 31st, 2026. Everyone, when they go to recredential, they will have to have a training requirement completed. Any of our OHCC training certificates will count as a substitute for that. And potential wage increases, and I'm going to show you a lot of wage increase charts here in a few minutes. And I say potential because some of them do require you to be working with somebody who qualifies. So that's why I said potential. And then stipend eligibility. And I'm going to show you where stipend eligibility comes in, meaning that if you do come to a class, sometimes you're giving up some work hours. So we want to compensate you for that. So we're going to show you how you can earn money while you're coming to class. All right, so we'll go on. And thank you for the team who is helping with responding to people's questions and answers. I'm unable to do that and talk at the same time. I can multitask, I just can't do that multitasking. Okay, So we talked about online learning as our main way of training. And where do you go? Well, you go to our online learning website. And a lot of you have heard of the term PACE. Well, what does that mean? Professional and continuing education. That's what it means. PACE is short for professional and continuing education. This website is hosted and owned by Oregon State University, and that's why you see OSU with the orange at the top there. The features of this online learning website, this is not, by the way, the website where an enrolled Oregon State University student would go. This is a website, they're a land-grant university, and they do a lot of community education. And so they have a lot of community education courses and certifications and programs. And we are on that platform. But it's a fully functioning learning management system. And on this platform, you can register for classes, cancel your own registrations, you can download materials, you can upload your CPR first aid card. We have an announcement board, and I'm going to show you where you can read that announcement board. And it's one of my favorite features of this whole program is the announcement board, because it's where we can get to all of our students really quickly, as long as you know it's there and you keep up on the reading of it. It's kind of like when you walk into Safeway, or it used to be you'd walk into Safeway and they had a big bulletin board in the lobby. I don't know why I always like to stop and read it and see what's going on in the community. It's kind of like that. So, just kind of get in the habit of stopping before you get going into your classes and reading the announcement board, seeing if there's anything new that's happening in your provider world that's important for you to learn. And then we also have a certification dashboard. That's to help you keep track of all the important things you need to know as you're earning your Oregon Home Care Commission certifications. Assessments, those are after you finish the class. Part of your certifications include assessments, and you take them right here on PACE. And then another really wonderful feature that we absolutely love is you can communicate to us, and we can communicate to you through your PACE account. And we love that, because before we got PACE, which was in 2022, we didn't have any way to communicate directly to you where it's saved. And if you lose your email from us that we sent through PACE, it's right there. You can go back into your account and read it again. Okay. So that's why we love it so much. It's so easy to find your information that we've emailed to you. Okay. So we'll go to the next slide. This is what the on your homepage when you sign in, this is an example of the announcements I was just talking about. If you take a look here, you'll see that the announcement shows the power hour. See that? It's on page 1. There's the power hour. And then we're going to talk about the new class that we just launched most recently, called the new course, Serious Incident Prevention. And mine says dismiss, dismiss. Yours won't say that. That's because I'm a staff person. Yours won't say dismiss, but mine does. And then look at that third one. It says PACE tutorial video. So Candace on our team made a video for you, and I would highly recommend you watch that. That is a really great video that walks you through the entire PACE. So you'll go, aha, I didn't know I could do that. It's a really cool way to learn about how you as a student can navigate your way through PACE, okay? Good news, we're going to be creating a lot more videos, and we feel, and this was a great idea that came to us from Diana, your representative from Care at SEIU. She really thought that would be a great idea to have more videos. And so we are creating them for you. And some of them will just be 1 or 2 minutes, but it'll walk you through and show you exactly how to do certain features. So how to upload your CPR card and how to do that on a phone, how to do that on a computer, or I'm just using that as an example. Or how to access the assessment, for example, or how to find my classes that I'm trying to register for, or how to cancel a class. So we'll have little videos for you, and then if you need help, you'll have a video tutorial to go to, and then you'll go, oh wow, that's so simple, and then you'll be able to do it on your own. So it's helping you be independent and self-reliant. And that way, again, it fits into your schedule. You can still earn these certifications, fit it into your schedule. You're not reliant on others. Okay. You can do it on your own. You can do this. We know you can. And then I want to point out down there where it says links at the bottom, where it says it has that green bar that says links. Look at that top line. It says Elevate newsletter, March and April. This is the first place we put it. That's if you look here, this is the first place we put the Elevate newsletter, and it comes in Spanish and Russian as well. And we put it in all three languages right there first. So if you look at this, you're going to find it there first. And that Elevate newsletter comes out every 2 months, and it is packed with a lot of really important information. It also has the schedule of all the classes for March and April in it. So you can look at, if you like to read, if you like to look on the schedule all in one place, there it is. You can also, of course, access the entire schedule in PACE itself. However, you won't be able to register a class unless 30 days before the class is launched. Okay, 30 days before. Okay, so in other words, if it's March 1st, you won't be able to register for a class on April 15th. Okay, it's too far out. The reason why is because we found out that a lot of people register for classes way in advance, and then they forget about them and they don't come to class. So we made it as close as we could. We make it 30 days, and then we send you some reminder notices to come. Okay, so let's go ahead to the next slide and take a look and see what we have on our next slide. All right. Oh, this is really great. This was a bargain. This is part of the collective bargaining that happened, and it launched in 2024. And I think we have over 1,100 providers who took advantage of this. And this is a great program that we really love. And if a person has a CPR card with a demonstration of skills, CPR first aid card, demonstration of skills, and it might be a certification letter too. It can, either one of them can be uploaded onto your PACE account. We have a place on your PACE account just for this, and it has a start date and an end date of the card. You can earn an additional 25 cents more just for uploading your card. And we also offer the courses at no cost to you. So we've had a virtual training course available for a couple of years now. It's very successful. And it is now, how do you register for that? Well, how you register for it is, first of all, we need to know which one you want to take. Do you want to take virtual, or do you want to take in person? And if you want to take in person, we need to know a little bit about you. Do you live in Ontario, Oregon, or do you live in Lincoln City? If we're going to help you get into a class, we need to know where are you? So we gather all that information on a survey. The name of the survey is Outcomer Survey. So when you go on to PACE, you'll find a class that's called CPR First Aid Registration. When you click on that, you're going to click and answer some questions for us. We check that every day, and you'll get an email from us, and it says, oh, thanks for an interest. I see you want to be you want to take the virtual CPR course. Here's how you get started, and you just follow those instructions. So, and the nice thing about virtual, again, a virtual course means you're going to take it on at your convenience. And there's two parts to it. All of our certifications you'll find here in a minute, I'll show you a chart. All of our certifications do require a CPR first aid card. Okay. All right, let's go to the next one. Next slide. So I know this is kind of a busy looking slide. I apologize for that. And we're not going to be able to go over all of it, but here's the good news. You're going to get a copy of this, all right? It's going to be posted on our website. And so you'll have access to this, and then you can look at it and compare it later if you want to. But I wanted you to see that the professional development certification is in that these are the different certifications that we offer. And the one on the very left, the column on the very left, professional development certification, that one is available to personal support workers, home care workers, and personal care attendants. And if you take that, if you earn that one, you earn 75 cents more per hour above your base rate. You could be at step 1 or you could be at step 2. So whatever your base rate is, you add an additional 75 cents per hour onto that. And I wrote down the different ways you can take classes, which is online, webinar, or in person, for example. How long does it take to earn it? Hey, we offer enough classes. You could earn it all in 1 month, even less than 1 month. I mean, probably. And then some of the things you need to take notice for core classes. Some of you are going to be going, 4? I thought it was 3. Well, remember the slide where I showed you the announcements? One of the announcements was the 4th, or the new core course, and it is called Serious Incident Prevention. It just launched. It's a really cool class, and it is a class that is training providers on how to be on the team that helps support consumers, employers from having an event or a disease that progresses to a point where their overall health declines, where they wind up in the hospital, in an emergency room, where they might lose their placement, their home living situation, where they may, it can be even fatal if it doesn't have some type of intervention, or the best way to prevent is to not start at all. So we spend a lot of quality time talking about how urinary tract infections, sepsis, falls, behavioral health crises, and I know I'm forgetting another one. There's one more.
Medication mismanagement.
And what was that?
Medication mismanagement.
And medication mismanagement. Thank you. How could I forget that one? So that is, and it's called a blended model, meaning that you start with the online learning, and after you complete that, you meet with all of us. And some of you might be in that class. We're meeting tomorrow for our first webinar class. So we are thrilled to have that class. It's been a long time coming, and we're very excited to add it to the professional development certification. So then the other part of the classes are, we've got a lot of safety classes to choose from and a lot of elective classes to choose from. And then we have once you earn your PDC, we call it for short, PDC. Once you earn that, you get the 75 cents for anyone you're serving in the Medicaid or OPI program. It's not just for some or others, it's for everyone. And it does require a CPR first aid. It's good for 2 years, as long as you keep your CPR first aid current. And it is also a prerequisite to get into the enhanced course. Now, I want to let you know that the way it's programmed on PACE is once you get a PDC, it opens the door. You should, once your PDC is complete, it'll allow you to see the enhanced registration. You can then register for enhanced if you'd like, because it now allows you to see the enhanced registration, and then you can just go ahead and register. All right. Now, what is the word stackable? Look at that very last line, stackable. What does that mean? That means the 75 cents can be added on to the differential, the $1 that the enhanced wages. See the $1 in the next row is enhanced. That's $1 more for the enhanced rate. Stackable means you can add your 75 cents plus your $1 together and stack them up, I guess, stack them on top of each other. So that's $1.75. And I'll show you an example here in a minute. Okay, so the first column is professional development certification. The second column is enhanced certification. The third column is exceptional certification for PSWs. And then the more recent certification is exceptional certification for home care workers. This is relatively new, and it is really focusing on challenging behaviors. And the last three, the last three, enhanced and exceptional, that one of those very first slides, I said that the certifications will potentially, or some, I forgot the word I used, but it was like potentially will give you a wage increase. The person you're working for, they need to have the qualifier for you to get those increased wages. And when the case manager does the assessment, when they're doing that assessment with the person, there is the assessment should capture the service need. And in addition to that, there might be some other requirements, such as total number of hours that are being utilized per week. And sometimes it's some approvals from central office that are needed, and before the person is accepted into the exceptional level. Therefore, that is when the provider, after they receive this training, would get the $3 more per hour. And notice the bottom line, not stackable with other certifications, okay? So hopefully that chart, again, I apologize, it's a busy PowerPoint slide, but hopefully it'll maybe clarify the difference between our different certifications right there. And we have another slide similar to this one. We can go to the next one. This next one, this one on the very left, ventilator dependent quadriplegia certification. My apologies, I forgot to say that that is just for home care workers only. And it is also referred to as VDQ for short. And that is very similar to how the exceptional works, as far as the consumer employer does have to meet the criteria. And oftentimes we do hear from a provider like, I'm not sure if the person I receive services for qualifies. You're welcome to call us on those. We're happy to connect you with those who can help you. You know, if you ever have questions about that, you know, we help providers navigate through, because it can sometimes feel like, oh, who do I check with? It's the case manager is who you do need to connect with. So, but if you were to call us, we can, you may be down the road and you forget that. If you call us, that's fine. We love to talk to you about it. And at the same time, we can talk to you about the training program as well. Okay. So, so we have the ventilator dependent quadriplegia certification. It's a blended model. Blended means that part of the training is online learning. Remember that. That's training on your own, online. Take it at your own pace. And the other half, it's half and half, is with an instructor on a webinar, a Zoom webinar. Okay. And then we have the CPR differential. We talked about that already. That is not what we call a certification, so it doesn't really qualify for the at the end, you know, where we were talking about how you can get when you're going to substitute for a required training for your recredentialing. A CPR differential in and of itself doesn't qualify for that, but we do offer this CPR differential, and it's 25 cents more. And of course, CPR is needed for all of our certifications. Oregon Intervention System General, OISG. If you are a PSW, you know what this course is. And we would love to see more people come to us and ask for this course, because we can pay for it. And it is kind of an expensive course. We don't have instructors under contract to train it anymore. We used to do that a while ago, but because the state, such a large state, it's best that students get their training in their own community. So what we do is we pay for it, and we have a survey that you complete to let us know where you are, who's your case manager, and we work with you and the case manager, and you connect in with a instructor, and then we pay the instructor directly, is how that works. So I want to just make sure I bring that forward, because we used to get a lot of students, PSWs, coming in, and we have not gotten very many in the last year or so. So I hope that means that it's just being offered in your community through other resources. But if not, please know we still do offer this. Okay. All right. So let's go to our next slide. I'm keeping my eye on the clock. So our professional development certification courses do have a stipend, and we do have, I want to make sure that you know that you can take the same class every 12 months. So if you took it anytime in July of 2024, you can take it anytime in July of 2025 and qualify for the stipend. You do have to be working to get the stipend. So receiving funds in the month. So if you received funds in the month of July, great. If you didn't, did you receive funds, a paycheck, is what I mean by funds, a paycheck in any of the 3 months before July? So June, let's see, June, May, or April. So that's a 4-month period of time we're looking at. And then if you did, great, then we could offer you we can pay you a stipend. It's based on your base rate of pay. So now we have a little bit different math equation we have to do, I guess you might say. And there's an example. Our mental health first aid course is an 8-hour course. If you're at the base rate of $20 an hour, your stipend would be $160. Okay. So we want to make sure that you're aware of that. So that makes it really incentivized, so that you don't feel like you're missing out on work and not getting paid. You will earn a stipend on the PDC if you meet that criteria. Okay, our next slide, please. Okay, I want to show you a couple of slides that demonstrate how your wage increases are affected by earning your certifications. And I'm going to start at the bottom of this chart. So this is a provider who has a base rate of $20 an hour, and they don't have any training, any certifications. So on the very right column, their new hourly rate didn't change. It's still at 20. Okay. The next line up, this person, they went out and earned their CPR first aid with a demonstration of skill, and they entered it into their account on PACE. And the next pay period, they earned 25 cents more. So now they have $20.25 per hour. Okay, then they got busy and took their classes, and they earned their professional development certification. And now they're going to get 75 cents an hour more, and they earn $20.75. You cannot stack the CPR. We learned that on one of our slides, right? Okay, now this next person, this is a different person here. Notice they don't have a PDC. They took a readiness assessment. They didn't do the prerequisite of a PDC. They took a readiness assessment and they passed. So they got to enter the enhanced that way. They earned their enhanced. So now they add $1 to their base rate, and they earn $21 an hour. But the person who had the PDC as their prereq, they took the enhanced. Now they qualified for the stackable of $1 plus 75 cents equals $21.75. Okay, then they decide, oh, guess what? The person I serve now qualifies for exceptional. Even if they do have a PDC or enhanced, nothing is stackable with exceptional, but the $3 is better than $1.75. So $23 an hour is their wage. The person who has a ventilator dependent quadriplegia who also has a PDC, they get to stack those two together, and their wage is $23.75 per hour. Okay. And let's go ahead and go down to the next slide. The next slide is an example of someone who has, if you look in the first row, a CPR dates. Look at the dates on there. Those dates are also listed on your PACE profile under your CPR tab. You'll see a start and end date of your CPR dates, okay? So your CPR is going to end on June 1st, 2025. The person earns a PDC, Professional Development Certification. After that, and they end it so that it's a 2-year certification. So that means that they're going to start off earning a CPR differential for the first part of their on January 14th when we first started the CPR differential. Then they move up to the PDC rate. But what happened on June 2nd? What happened? Their CPR expired and they did not renew their CPR. So what happens to this case? The person loses their PDC rate. They don't lose their certification. We know that their PDC certification is good all the way till March 16th, 2027. But because their CPR expired, that means that their PDC rate ends. So CPR, it's very important that you keep track of your end dates so that you don't have this happen to you. Hopefully it won't ever happen to you. You can sign up and get one of our CPR classes 3 months before your CPR ends. Okay, that's very important. Definitely you're going to want to do that. And that again is posted on your dashboard, on your certification dashboard. That's why we created a dashboard, so that you can see and look at that. Okay, let's go to the next slide. And on our next slide, oh, wow, we're coming towards the end here. So on our next slide, we are going to be letting you know that, well, first of all, I know that I talked a little bit fast and I apologize, but I wanted to make sure I got in all the slides in that short period. That hour went by really fast. I want you to know that we are going to be posting this recording, and we'll give you a copy. This will be in a PDF copy, this PowerPoint. We're going to post it and the recording, and we'll put some supporting documents of some things that I talked about today all in one area called Power Hour on our website. We do have your email because you did pre-register with an email. So once we get that posted onto our website, we will email all of you and give you that information with a link so that you can locate it. And we'll do that as quickly as we can. It will take us just a little bit of time to get all that posted. And after that, if you want to go back and review any of the information that we went over today, that would be great. If you have any questions about it, we would be happy to clarify or answer that for you. I'll make sure that we give you contact information in the email that I send you so that you will have that. I also want to bring your attention to what David reminded us and Jenny reminded us. This is our very first Power Hour. We're going to have them every single month. Wednesday, April 23rd, same time, 11 to noon. And Carewell SEIU 503 will be the next host, and their topic of discussion will be about a benefit employee assistance program, also known as EAP. We hope to see you there. And you do have the link already. It's going to be the same link. You can pre-register in the same link, and you just look for the date and click it and pre-register. However, we will send it out again to everybody. All right, that takes us almost to 11 o'clock. It's 11:57. And we want to just thank everybody for being with us today. We really appreciate you, all the work that you do every day. People all over the state of Oregon are very appreciative of your devotion, your dedication. We hope to see you in class. We love connecting with you via Zoom, in person. And if there's anything you need, please reach out to us via phone or email or through your PACE account. All right. Thanks again. Susan, did you have anything you wanted to add?
Nope. That was it.
All right. Thanks everybody for joining us today. Have a wonderful day. Bye-bye.
Спасибо
Bye.
большое. Хорошего дня. До свидания.